What are the differences between a heart attack and stroke? A step-by-step training video from the Academy for First Aid and Safety. When it comes to coronary artery disease, there are two types of life-threatening emergencies you will learn in this video: heart attack and stroke. Let's first discuss how to minimize your chances of coronary artery disease. You can minimize your chances of coronary artery disease through lifestyle changes. One of the biggest contributing factors is your diet. Having a well-balanced diet plays a key role in excellent cardiovascular health. Next is exercise. Exercise is a great way to manage good cardiovascular health, lower blood pressure, and strengthen the heart. It is recommended to exercise 3 times a week for about 30 minutes each time. If you smoke, it's important that you seek medical help and make every effort to stop smoking, as it could damage your arteries and contribute to coronary artery disease. Last but certainly not least is to manage your stress levels. Participating in yoga, for example, is a great way to lower your stress levels, calm your mind, and train your mind to manage them more efficiently. This can have a great effect on your blood pressure. Now let's discuss the signs and symptoms. What are the signs and symptoms for a heart attack? The most common sign or symptom is chest pain, where the patient clenches their hands on their chest. They may also experience nausea, vomiting, confusion, cool, pale, sweaty skin, and unresponsiveness. Please note that chest pain is not always present for heart attack patients, but it is the most common. What is happening to the heart? During a heart attack, also called a myocardial infarction, part of the heart muscle is not getting enough oxygen-rich blood. This usually happens because one of the coronary arteries, which supply blood to the heart, becomes blocked, most often by a blood clot that forms on top of fatty buildup, plaque, inside the artery. How do you care for a heart attack? Call 911 right away and give your patient aspirin. Either 2 low-dose or 1 regular-strength aspirin is recommended. Aspirin is an antiplatelet medication which would prevent further clotting and is also a blood thinner which would improve circulation. What are the signs and symptoms of a stroke? To identify a stroke, always remember FAST: face, arms, speech, and time. Is the face proportionate? Can they raise both arms up to the side? Can you understand their speech? Time to call 911. What is happening inside the brain during a stroke? The 2 most common strokes are ischemic strokes and hemorrhagic strokes. Ischemic strokes are very similar to a heart attack where there's a blockage in one of the arteries. A hemorrhagic stroke is a ruptured artery causing internal bleeding in the brain. Here is a simulation of an ischemic stroke due to a blood clot in the artery preventing blood flow to the brain. And here's a simulation of a rupture inside one of the vessels in the brain, also known as a hemorrhaging stroke. How do you care for a stroke? Immediately call 911 and get an AED. Next, note the time of when the signs and symptoms of a stroke happened. For example, if the time is currently 11:30 a.m., and the patient said they were experiencing head pain half an hour ago, note the time as 11 a.m. Have the patient sit down or lie down and keep them warm by placing a blanket over them until paramedics arrive. When the paramedics arrive, let them know the time of when the stroke occurred. The key is to get the patient to the hospital as fast as possible for immediate intervention and treatment.